I came out at 13 years old as bisexual, and then I also came out as transgender when I was 14. I had a strong, persistent, and insistent identity that I was a male, a boy, in the wrong body. I had a very distorted perception of myself. I really hated myself, and I didn't know why at the time. I chose to have 2 different medical procedures. One was taking testosterone weekly. The second one was having a double mastectomy, also known as top surgery. It was later into my transition that I started to question whether or not transitioning was right for me. So I started to do some internalized, introspective reflecting and healing, and I came to the conclusion that transitioning was actually not the right decision for myself. So I decided to stop taking my testosterone. I was having severe mental health issues. I would tell my endocrinologist and they wouldn't really pay attention to it. And then later when I started to heal my trauma, I realized how disassociated I had been from my body for many years. And I also wish that that had been addressed while I was going through the process of transitioning. So while I was on testosterone, I experienced a lot of mental health symptoms. I was put on a suicide watch 4 times and was in an inpatient psychiatric ward for those 4 times. And after 2 of those times, I did outpatient rehabilitation programs. On top of also being on testosterone, I was put on an antipsychotic, antineurotic, antidepressant, anti-anxiety, and a mood stabilizer, all which also gave me some more side effects. As I got a little older, I started to really question my thought process behind what I perceived as feeling like a boy. Because a lot of these feelings were developed while I was a young child and also going into my teenage years. And I realized that a lot of it was based in stereotypes. I thought that I was a boy because I enjoyed doing typical boy thing. And I came to realize that a lot of what I wasn't allowed to do was just because I was a girl. My younger self needed someone to talk to. My younger self needed someone to tell me that I wasn't crazy and that women don't have to look feminine to be a woman. That the hypersexualization of my body is not my fault and or my responsibility. I needed to realize that just because the individuals around me were telling me I couldn't be masculine and a female was not true. I'm not taking any hormones right now. I've been off of hormones for a year and almost 5 months. While taking testosterone, I was also on a hormone blocker. It was an implant, and these are the scars that I have from having it put in and taken out. And I'm no longer on any sort of hormone blocker either. And I didn't start my hormone blocker until I was 18 because I did not have parental consent to start it while I was a minor. And looking back on that, at the time, I was really upset that I couldn't start a hormone blocker or hormones when I was a minor. But now I'm really thankful because it allowed my body to develop. If I could just snap my fingers and change everything and go back in time and not do anything, I would. But I can't because we don't live in this perfect world. So that's why I've come to peace with how I look. When people ask me why don't I shave, it's because I accept my body hair and I just don't want to put in that much effort every day to shave my face. It's exhausting and it irritates it, for example. I realized that I made all of the decisions that I made because they were based in trauma. And something that really weighs heavy on me is that I can't make peace with my breasts because they're not physically there anymore. My top surgery was really painful for me, and it resulted in my skin having a lot of stretch marks on my chest. Also, the scars did not heal properly, and they were extremely red for the last 5 years after top surgery. I just now had to start doing laser therapy on them to reduce the redness. And overall, the area did not gain back 100% sensitivity. And at the end of the day, that's what I really want back, is my own breast, because I think about how if I am deciding to have children in the future, I can't breastfeed them. And that makes me sad.